This is my patient Hadley, and we're going to be testing her hip abduction, abduction, active range of motion. So Hadley, go ahead and lay down on the couch for me. You want to find her iliac crest, and then work your way down towards her ASIS. So go ahead and put your 2 fingers over my thumbs, Hadley. This one a little, there you go. The fulcrum of the goniometer is going to go over the ASIS, and the stationary arm is going to point towards the other ASIS, and the moving arm is going to point towards the patella. So I'm going to have Hadley abduct, but I don't want that leg to externally rotate, so I'm going to stop her before she does that. So you go ahead, Hadley. A little more in. No, this way. There we go. And she is at 35 on this side. Let's go ahead and switch sides. Same thing on this side, I'll find them again. All right, right there, I have them. Fulcrum over. Stationary arm pointing the other way. All right, go ahead, Hadley. Stop right there. Move it back again a little. There you go. And on this side, she's at like 33, just a smidge under the other side. The next one we're going to do is the knee patellofemoral medial glide passive range of motion. So Hadley, I'm going to have you lay down on your back. And since we're doing the medial glide, we're going to test on the lateral side. So my fingers are going to go on this side of her knee. And I'm just going to push inwards, medially, with those 2 fingers. And everything feels fine on this knee. Any pain, Hadley?
Nope.
The patella is moving fine. Let's flip and do the other side. Same thing. Pushing inwards. How's this one? Pain?
We're good.
Same thing there. Pushing inwards. And this one feels fine as well. There's no clicking. Nothing feels out of place. And that is the medial glide. The next thing we're doing is the Thomas test. And this test is used for iliopsoas tightness. The sensitivity is 89 and the specificity is 92. So Hadley's going to be supinated on your back with this one. And what we're gonna do is passively bring one of her legs up to her chest and see if the other leg comes up. If the other leg does come up, then it's positive for iliopsoas tightness. So I'm gonna raise your knee up, bring it to your chest. And her other leg is still down, as you can see. Do you feel any pain?
Nope.
Feel tight?
Nope.
All right, switch. Same thing, bring it up, knee to the chest. Same thing, pain,
Nope.
nothing. Okay. And that is the Thomas test. Next is going to be a grade 3 manual muscle test for a knee extension. And the muscles used are the sartorius and then all the muscles in the quadriceps group. And the patient will be sitting at the edge of the table. We don't have a table, so Hadley's sitting in a chair. So all the way back from Ken. There we go. So you're gonna stabilize right over her quad muscle, distal femur, and I'm gonna have Hadley just bring her knee up as an extension. So just lock her knee out. Yep. Back down. And the movement is controlled and she's able to do full extension. So she's good. Test on the other side. Just go a little slower so we can see the control. Go ahead. Perfect. All right, back down. And that is the grade 3 manual muscle test for a knee extension. The next one we're going to do is the flexion adduction axial compression test. It's a special test for the hip. The sensitivity is 100. The specificity is not tested. Oh, also this test is used for hip impingement or labral tears. Go ahead and lay on your back, Hadley. So I'm going to put one hand over her patella, the other one under her foot, and bring her hip into flexion and her knee. Then I'm going to adduct her knee slightly in, and then I'm going to apply pressure downwards. This test would be positive if Hadley felt any pain, or if there was any clicking or popping, or if anything felt out of place here. And I'm not feeling that for Hadley. And then also you would look posteriorly for any labral tears. So let's test the other side. Same thing, come up. There we go. Adduct in, apply pressure downwards. And that is the flexion adduction compression test for the hip. The next test we're gonna do is the valgus stress test for the knee, more specifically for any MCL damage or capsule damage. So I'm gonna have Hadley lay on her back. For the first part of this, her leg's gonna be totally straight. I'm gonna grab from the medial side of her ankle foot. Then on her distal femur, I'm gonna be on the lateral side. And I'm gonna have her externally rotate a little. I'm gonna apply pressure in the opposite direction in both hands and see if there's anything out of place there with the MCL, and really see if there's any pain from Hadley. How does that feel?
Very good.
For the next part, we're gonna be testing the capsule. So we'll bring her leg up into about 20 degrees of flexion. And same thing, I have her externally rotate and apply pressure opposite directions in both those spots. This is the sensitivity for this? The numbers or not? Okay. The sensitivity for this test is 91. The specificity is 49. So same thing on this side. Knee completely straight, just applying opposite pressure, and while her leg is externally rotated. And then for the capsules, same thing. Externally rotate 20 to 30 degrees and applying pressure in the opposite directions. All right. The first palpation is going to be the palpation of the sartorius muscle. So I'm going to have Hadley lay on her back. I'm going to locate her ASIS. Then I'm going to resist around her ankle on the medial side and have her do a figure 4. And I can feel that muscle right there when she does that figure 4. Go ahead and straighten your leg again. Same thing. Go ahead. Yep, and as soon as she makes that movement towards her knee, I can feel that muscle firing off. So let's test the other side. Same thing. Yep. And that's the palpation of the sartorius. The last thing is the palpation of the medial femoral condyle. So we're gonna start down at her knee, where her meniscus and that plateau is in her knee.
You can't see my knee.
Oh, right here. And then we're gonna work superiorly upwards. You're gonna find 2 round spots. There it is. And that is the medial femoral condyle. And I'll test on the other side too. Same thing. And you can really see yours.
You can see it?
Yeah, the plateau is right there.
Cool.
And there it is on the other side.